Yes, the CAPTIVATE study is an international multi-center phase II study evaluating patients with chronic lymphocytic leukemia in first-line treatment. And the cohort, there are two different cohorts, a so-called fixed duration cohort and the MRD, minimal residual disease cohort. And the results of this cohort I presented at ASH this year. In this case, the patients were treated for 3 months with Ibrutinib as debulking agent, and then for 12 cycles, 12 months with a combination of Ibrutinib plus Venetoclax. At the end of the 12 months of combination, patients were randomized based on the level of MRD or minimal residual disease achieved. Those who achieved undetectable MRD, they were randomized to either stop the treatment, so placebo arm, or continue Ibrutinib monotherapy. The patients who did not achieve the undetectable MRD, they were randomized to continue either Ibrutinib monotherapy or Ibrutinib plus Venetoclax. And this year I presented at ASH the 2-year disease-free survival. And the disease-free survival is different from the progression-free survival because it considers not only freedom from progression of disease and death, but also freedom from MRD relapse. So it is much more stringent than the PFS rate. And in this case, we show the 2-year disease-free survival of the placebo and Ibrutinib arm. And here they are both more than 95%, so with no significant difference. So suggesting the idea that patients with confirmed undetectable MRD can safely interrupt the treatment as there is no difference with continuing Ibrutinib. We also presented the 3 years progression-free survival for all the arms of the study. So for the placebo and the Ibrutinib arm, for the patient who achieved the undetectable MRD, but also for the Ibrutinib and Ibrutinib plus Venetoclax arm for the patient who did not achieve the undetectable MRD. And altogether, the PFS, the 3-year PFS rate is more than 95% in all the 4 arms, indicating that if we tailor the treatment based on the level of MRD, we can optimize the outcome for all the response in all our patients. We achieved these amazing results, I would say, with a very safe toxicity profile. So the combination of Ibrutinib plus Venetoclax did not show any increase in terms of adverse events, with the exception of diarrhea that was present in more than 50% of the patients, but in most of them, if not all, of low grade. On the other side, patients experienced adverse events in similar frequency expected from the monotherapy. So like, for example, 35% of patients experienced neutropenia, likely due to, mostly due to Venetoclax, but this did not translate into an increase of infection that was only present in 8% of the patients. Also very low frequency of atrial fibrillation and major hemorrhage that are typical adverse events associated with the Ibrutinib